and welcome to National Herald. We will discuss today the impact of second wave of COVID-19 in India and why Indian government should urgently work on its public health policies. Joining me is Professor KR Thankappan, who's a public health expert. He is Professor Emeritus at Sri Chitra Tirunal Institute. He's a Doctor of Medicine in Preventive and Social Medicine. He's a Master of Public Health in International Health from Harvard University. Welcome, sir. Welcome to National Herald. Sir, my first question to you is, has the second wave of COVID-19 highlighted once again all that's wrong in our public health care system? Or COVID-19 would have killed and harmed people in this magnitude even if we had a great public health strategy in place?
We have learned a lot of lessons from the COVID experience. We also had a previous experience like the plague and several SARS epidemic and previous epidemics, which were also some lessons. But I think we could not learn the lesson and implement the public health system in order. Because the public health system, according to me, in India is in a very bad shape. Probably that's primarily because the health expenditure for the health system in India is one of the lowest in the world by any standards. We are spending about, the latest figure is about, we are spending about 1.28% of the GDP on health. By any standards, this is one of the lowest in the world. So the World Bank has ranked the world into different regions, high income countries, low income countries, low middle income, upper middle income. In all these countries, even in the sub-Saharan African region, of course, it includes South Africa, which is some comparatively richer country. Even if we exclude South Africa from the sub-Saharan African region, we are spending lower than that region, sub-Saharan African region, on health. Now, this is probably the major reason, according to me, why the public health system is in a very poor shape in India.
Why is it so less? Is it that we lack resources, we lack money? Why are we not inclined and motivated to invest in public health? Because we do invest in space science and various other scientific ventures. So why not public health?
I don't even understand. And in fact, I also searched the literature why we are not able to spend money. All the arguments are actually for spending more money. In fact, all researchers, all policymakers, and all policies, in fact, are saying that we should spend more money on health. But unfortunately, that is not happening. It's not only for the last 10 years, but probably last 20 years. It is stagnant about 1%, 1.2%. That is very, very low. In fact, even with this economic growth, before the COVID, in fact, the economic growth in India was huge. I think we were probably, emerging economy, and people were saying that if you want to compete with the developed countries, we should spend on health, and the human resources for health is very important. Then only we can compete with other countries. We can say we are developed. We are a developed nation. So, in fact, spending on health and education is probably crucial. Anybody will agree that this is the most crucial thing, so that we can be a developed countries, at least in the near future, or maybe 10 or 20 years from down the line.
What do you think would have saved us from COVID-19? I mean, I understand that there would have been some harm, many deaths anyways, but looking at various other countries with their public health policies, we're also seeing that that they have taken care of their people much better than us. So what is it in public health that we're missing out on?
So in fact, the COVID-19, the second wave is now actually going to the rural areas, spreading to the rural areas. In the rural areas in India, so there is no public health system as such. You have to educate. Public health system also will have to be supported by other systems like education of the population. Because if they are not educated, they are not aware. It's very difficult to educate the people. Awareness is not there. So they are not, for example, vaccination. Initially, you remember there was a lot of hesitancy, and when vaccine was there was hesitancy. Now, because there is a shortage of vaccine, everybody is actually going after the vaccine. So I think lots of issues are there. People should be educated, and the infrastructure should be there. The human manpower should be there so that they can educate the public. So all these things are not happening because the primary health center, the Anganwadis, the ASHA workers, the grassroots health workers are not sufficient. Even according to the our own standard, there has to be a primary health center for about 30,000 population in plain areas and 20,000 population in tribal areas. But as of now, the latest statistics indicate that we are short of that. We have about one primary health center for an average of 35,000 population. So we are not, even for example, community health center, we should have a 1,20,000. There should be a community health center. We are having about 1,50,000, something like that. So everywhere we are having shortage. Grassroots level workers. Now this is easily done. This can be easily done if you spend a little more money. It can be easily done. So we are not spending. Probably, I think the philosophy is that if you develop the infrastructure, maybe some people argue like that. If you, for example, in buildings like railway stations, railways, roads, other construction which are visible to the population, and definitely most politicians are inclined to do things like that so that people can see. So if you do preventive services, who is able to see this? You can claim that you have eradicated smallpox. What is the evidence? People will say, I don't know. You are going to eradicate poliomyelitis. What is the evidence? It is not visible for the population. For politicians and policymakers, it is easy to show them. I have built these hospitals. You can see this. Five-star hospitals, MRI scans, CT scans, all these are visible for the population, so you vote for me. No, that is the general tendency world over. And this is happening in India more often than other places, I think. So probably that is one reason we are not spending really on health and also education, I think.
Lack of political will, because it's not so visible as a road or so-called infrastructure is visible. That could be one of the reasons why the investment is less. There is a lot of talk about how big specialty hospitals and private hospitals need to be established. But we have seen in COVID-19 times that a lot of private hospitals have actually shut down. I mean, all over India.
Privatization, no. The problem with the privatization is what is the motive of private hospitals? They want to make profits, no. In fact, that is the main reason why, if you look at any European countries, even US, probably US also spending almost 50% in public funding, Medicare and Medicaid, etc. Best example is NHS for the UK. In UK, about 80 to 85% is public money. And most of the European countries, including Canada and other European countries, are spending 80 to 85% of the money on the public funding, government funding. That is because people should not get profit from the illness of the people. That is the philosophy of that. I think also privatization, we can have privatization to a certain extent, but it has to be highly regulated. But there is no regulation of private sector. For example, you must have heard news from all this media, under the newspaper, print media, electronic media, etc. Huge amounts of money was charged from COVID-19 patients, even in the first wave. In second wave also, this is happening in some states like Kerala. I think they are restricting the money, but even then, some organizations are against controlling the private sector. So I think problem with the private sector is very difficult to regulate unless you have a very strong will to regulate. That becomes so ideal situation will be spend money from the public sector, more money. So that is, in fact, even if you add the public sector, private sector combined, the total expenditure is about less than 4% of GDP in India. This is also one of the lowest. That is the problem. So health is not a priority. That is the issue. Only when, I'm not sure whether even after COVID, if COVID subsides after the second wave and there's no third wave, etc., I don't think people will definitely spend more money on health. The attitude of the policymakers and the governments generally in India is that once the epidemic subsides, everything is forgotten. So that is the big challenge we are facing, I think, in the public health.
And that is perhaps what happened after the first wave, right? I mean,
that has definitely happened after the first wave, and there was a complacency that we almost controlled the epidemic, and we could not listen to what happened to the European countries, Western countries, and the warnings. I think we thought we completely controlled the COVID-19 first wave.
What could we have done, and what should we do from here on? What would be your advice on that?
We should have, I think the vaccination should have definitely gone up. In fact, you are reading the newspapers about what happened in Israel. No? In fact, they purchased the vaccine on the double price, from Pfizer, and then and there was a question about the Israel's the Prime Minister. Why are you spending this much money on vaccines? You are actually buying the vaccines on double price. Why are you buying this? Then the answer was that is a small amount compared to the lockdown loss. No, if you then now Israel is a small country, of course. We cannot compare Israel with India. India is a huge country, and then even then the philosophy is that we save a lot of money from loss of lockdown. No, everybody is unemployed. There is no generation. Economic loss due to lockdown is huge. Then probably we should have spent a lot of money on vaccines, and probably the vaccine protection should have been given to other companies also, rather than restricting to only one or two companies. There are other companies. India is a superpower, according to me, in vaccine production and drug manufacturing. No, India can manufacture a lot of drugs. We should have utilized the capacity and given to many other companies, so that we could have increased the vaccine production in India, so that we could have vaccinated a larger number of population.
I want to know about your personal opinion. Were you surprised with the number of deaths we saw in second wave, or are still seeing? Were you surprised? Did you think that we were horribly and horrifically unprepared?
We are unprepared. I think we were not anticipating this many deaths and infections, and I think that is a fact, according to me. Otherwise, we should have been little more careful. So I think these deaths, as of now, I think 2.5 lakhs deaths are there. I think it is definitely much higher. And also there is an argument that even this number of deaths is under-reported. Not only in India, many countries, there's a lot of under-reporting. So I think that is also because of the public health system, because we don't have a very strong public health. Even when public health systems are very strong, even in the United States, people are saying there are under-reporting, about 50% or 75% under-reporting, even in the United States. So probably the under-reporting is likely to be much more in India because we have a much inferior health system, and the death reporting, testing, all these things are lower than the infection rates detection. If people are not detecting the infection rate, that will not be attributed to COVID-19. No, if they not test them, then how do you know whether it's a death due to COVID-19 or not? So that will be even starting from the identification of the cases to testing and identifying that patient as a COVID-19 patient. There are almost every stage, I think there is a lacuna, so that we probably are likely to underreport the deaths more than any other country.
Sir, when we keep hearing these talks about public health and consolidating, solidifying, strengthening our public health service. Can you explain to us, what does it actually mean? Because there are lots of viewers who will be watching the show. Tell us, what does public health system mean? What does primary health center mean? What are these things?
There is a primary health center, supposed to be a sub-primary health center for every 30,000 population in the general area, plain areas, and 20,000 population in the tribal areas. These population are supposed to be covered by under the supervision of a medical officer and a team, maybe more than one medical officer, depending upon the states. And these primary health centers are supposed to take care of the population, not only curative health. We are supposed to take care of the preventive, promotive, and rehabilitative, all stages of health. So that is what we mean by public health. So public health, you have to, there's a promotion, early promotion. Then as soon as the disease is occurring, you have to detect them early and diagnose them, and also treat them early so that they don't go to complications and disabilities are restricted. And if there are disabilities, rehabilitation services also will have to be provided. So these are all stages of primary health care, and public health system is supposed to address all these stages. If not only now, the problem in India is not only the communicable disease like COVID, the non-communicable disease is also a major problem. And there's a strong connection between non-communicable diseases and communicable diseases such as COVID. because those are more vulnerable population, particularly in a state like Kerala and Tamil Nadu, the southern states, the NCDs, non-communicable diseases, are highly prevalent. For example, in Kerala, the diabetes prevalence is about 20% among adults. It's one of the, Kerala is known as the diabetes capital of India. And other diseases like heart attacks, diabetes, heart attacks, cancer, and also chronic lung disease. All these diseases are vulnerable to COVID-19. And when the COVID-19 attacks them, definitely the mortality and morbidity will be much more higher among this population. So that is also a problem. So all these things will have to be addressed by the primary healthcare system and preventive. And if you look at the treatment, the control rates of diabetes and hypertension, we had a recent survey at the national level, and it's found that the control rates of diabetes and hypertension, control rates means less, diabetes control means less than 126 milligram per deciliter fasting blood sugar. That is the control rate of diabetes. And hypertension control means less than 140 millimeters systolic blood pressure and less than 90 millimeters diastolic BP. And the control rates, even in a state like Kerala, is 13.5% for hypertension and 15% on diabetes. Now, this hypertension control rate is, you compare to Canada, it is 66%. UK and US about more than 50%. So where are we? Even in an advanced state like Kerala, the control rates are so low in NCD.
Where you have a reputation of actually recording and registering and reporting illnesses far more than the rest of the states in the country. And that's also a point.
Even then, this is community-based survey I am talking about, which is, this is a population representative sample study, scientific information. And also, as you said, we have a good reporting system. The access to healthcare is very high. Everybody has access to healthcare in Kerala. Even then, so these are some of the issues the primary healthcare system should address. Why the control rates are so low? So when the control rates are low, diabetes is not controlled, hypertension is not controlled, means then again, if you get a COVID, then your mortality chances are higher. So all these are adding to the morbidity and mortality due to COVID-19. So I think these are all public health challenges, public health issues we need to address. So you start from the southern states of Kerala and Tamil Nadu and go back to UP, Bihar, Madhya Pradesh, Rajasthan, Orissa, Assam, etc. Then there is big variability of, among the illnesses and the control rates, and also how people are managed by the public health system. So that is a big challenge, and we need to invest in human resources and infrastructure in primary healthcare system so that you will achieve a universal health coverage.
I have read some of your interviews, and one of them you also mentioned that most states don't have a public health cadre like Tamil Nadu. What did you exactly mean by that?
I would say I would encourage that there should be a public health cadre like Tamil Nadu in most states, because the advantage of public health cadre is they are actually interested in population health. So they are interested in preventing illness. They want to see that all the population under them are healthy population. Whereas the curative disease, no, if you are interested with a clinician or other cadres of medical care, they are interested in day-to-day seeing patients and treating individuals. So probably, particularly when you have a strong private sector, which is motivated by more number of patients. No, naturally, if hospitals are run based on profits, probably the hospital management and also the staff working in them definitely will be interested to see more patients. And if you put a clinician in the top of a district, what is his interest? Basically, he is not interested in reducing, he doesn't know about the population because he has not studied that one. So that is one of the major challenges India is facing now. Even at the top national level health system, there is no public health cadre. Most states, they don't have public health cadre. So if you have a public health cadre, the health system will be definitely tuned to address these issues so that you improve the health system, so that the population health, preventive health, promotive health is improved, so that healthy population is increased rather than unhealthy population. That will be the role of public health people and the public health cadre.
You've also mentioned repeatedly in various write-ups and interviews that there has to be public health education. There's a lot of emphasis on public health education. Why? Why is it so important? And what does it mean?
Means people are not even aware. No, even among, what happened to this COVID-19, even first wave and second wave, people are not aware that it is going to happen to them. For example, why people are not wearing masks, social distancing. And many people why are you going for the crowd? And why should they should not go for that? No, even after lots of media coverage and education, press media, electronic media, all sorts of communication, people are not convinced. So education, maybe it has to be reinforced, different methods of education, so that different segments of the population are addressed. Because some segments of the population probably know this is bad. But even after knowing, they may indulge in this kind of bad behavior. For example, tobacco, alcohol, physical activity, all these risk factors. Why doctors are smoking. They are aware that smoking is injurious to health. Even then, health professionals, including doctors, some of them are indulging in smoking, alcoholism. So I think we have to have a strategy so most of the segments are educated, so that they, different kinds of education, not only education, also combined with the legislation. That is why now we have to enforce the law, including the Epidemic Prevention Act, etc. So that if you don't wear mask, you will be punished. You will be penalized. So some charges will be fined. All those things are there. So it has to be a combination of education and combined with, I think, law, so that public health law, so that more people are adhering to the government guidelines, so that the prevention of COVID-19 and other infections can be controlled.
Thank you very much, sir. Thank you for your time. And my takeaway from this interview is that there is an urgent need, as you said, that this could be an opportunity for India to actually work on its public health system. And if I'm not mistaken, you said 4% of the entire GDP is, even if we invest well, it will be 4% of entire GDP to public health sector. That's what you said, right?
As of now, we are spending about 1.3%, 28, I think, exactly 1.28, 2018-19, 1.28% of the GDP is spent on health. That is very small. Although almost all agencies recommend that up to 5% of GDP is the required for the public sector, not only together. So even if you are the private sector, it is about 4%. That is very, very small.
That is very, very small. And if we, there can be no bigger investment than investing in the people of the country, in the health of the people. And that's a very important point. And I hope our policymakers will invest time, energy, and money on people's health and life. Thank you very much, sir.